This segment sponsored by Viking Psychiatry. Welcome back to Mental Health Matters with Viking Psychiatry. And joining me today is Sean Goddard, their founder, and we're going to discuss an important topic about depression. Hello, Sean.
Hi,
welcome.
So good to see you again. Thank you.
You as well. Okay, so depression is one of those weird feelings, right? That can mean different things. It can come from different places. But today we're going to dive into depression beyond sadness. Okay, so what does that mean? Because sometimes people do conflate the two.
Yeah, so depression is really just a clinical mental health disorder, right? It is a diagnosis that tends to be persistent and overwhelming. It can cause physical changes, change the way that we have in energy and motivation and all those type of things. With depression, we often see many core symptoms like emotional changes, physical changes, cognitive, so difficulty remembering things, concentrating, right? And we can even see behavioral changes such as like social withdrawal and those types of things. Whereas with sadness, it tends to be of a more fleeting nature.
And so how can we really identify depression versus sadness? Like, how does it get to the point that it's beyond sadness?
Yeah, so when you think of sadness, I tell people to think of individual events, right? Sadness tends to be linked to a triggering event, right? Maybe it's your favorite football team loses, right? Or maybe it's something a little bit more severe, like losing a pet or something like that, right? But sadness is typically linked to an individual event. It's often time specific, right? So it tends to be something that isn't long-term, right? And it's something that we see progressively get better generally, right? Whereas with depression, we see depression as being more persistent and pervasive, right? It kind of takes over life for people. And we often see that it occurs without necessarily any type of clear trigger, right? You know, you talked about your back bothering you, right? And what happened with my back? Why is my back hurting, right? Well, depression can sneak in like that. You wake up one morning and you feel down and you have low energy and low drive and motivation, and you don't necessarily understand why you feel that way. And depression can really come through that way.
Yeah, and I kind of think of it like sadness being a feeling, right? While depression may be a state of mind in a way. Because, like you said, it's an event that triggers it, but it's also the longevity of it. So sadness being temporary. I mean, think about a time that you've been sad or that anyone's been sad. It's like, how long have you been sad for that one particular thing? Normally, feelings go up and down. So then you're feeling sad, then you're feeling happy, and maybe you're feeling angry later. But depression is so weird. It's like that dark cloud that no matter what feeling you're going through, that dark cloud stays and travels along with you. And so how can people really know, outside of the longevity, but really know which one they are struggling with and how do they get treatment for it?
Yeah, you made a good comment about depression being a state of mind, but I actually would go a step further and say that depression is a state of body, right? When we have sadness, we feel it, right? We emotionalize it. We're able to express it often, right? We're able to say, you know, I'm sad because of this happening, this event happening, right? Where depression is more of that, it's a state of body, right? That our mind changes, our activities change, the way we feel physically can absolutely change, right? From those low energy, low motivation to having no what they call apathy, right? And just not really caring about anything. Or finding no joy in the things that you used to find joy in. And so what I tell people is sadness, like we talked about, tends to be more short-term, whereas with depression, clinically, we look for those symptoms lasting a minimum of 2 weeks. But it's not just 2 weeks. It can be months, and regretfully, sometimes for people, years. And so it's important that when we're feeling that way, and if we're unsure, right, I go back to being in school, right, and I remember this teacher that I had, or the military, and they would tell me there's only stupid question is the question not asked, right? And if we're questioning whether what we're going through is something more, then we probably need to ask somebody who can tell us whether it's something more and what we can do to help ourselves.
I like that. And that's good. And it makes me think about what you were saying about my back. So right now I have a pinched nerve. And that's something that's like, ooh, but it's not chronic, right? It's not long term. It just happened. It'll happen for like, a couple of days and then it'll be gone. So that little shortness of time I may need some Advil or something else. But if it's chronic and continues, that means that there's a deeper problem. So I need to go see someone to get the treatment for that long term.
Absolutely.
So when someone has depression, which is a long-term state of mind or state of body, as you say, then what can they do? How can you help them with that state?
Well, it's not just at Viking Psychiatry. We want anybody who's struggling with mental health to reach out, whether that's 911 because it's an emergency or going to the ER to 988, the Suicide Crisis Hotline. But at Viking Psychiatry, we offer some of the newer interventions and we prescribe some of the newer options. There's an amazing new medication out there called Auvelity. It's a first of its kind, rapid-acting antidepressant, and it can make a difference in as little as a week. With Spravato, which we've talked about before, the intranasal esketamine, we can see short-term and long-term changes very quickly in individuals with these type of treatments. And we offer non-medical options, medication related, right? Like TMS, transcranial magnetic stimulation. We are excited starting next week, we're starting something called ketamine-assisted psychotherapy, where we give people a low, very, very low dose of ketamine right before their therapy session that enables their mind to become more flexible and pliable and more open. And we see large advances in therapy with this. And so there are options that are out there that maybe haven't really been talked about before or necessarily been available in this market before.
Yeah. That's good. Good stuff. So if someone is feeling this way and they may need to seek treatment, but also if they know someone who may be experiencing depression, it's important just to listen to this information to be able to refer ideas, to have an open dialogue, right? About what depression feels like. What are the symptoms? How are you doing? And have you sought treatment? It needs to be, the stigma needs to be brought down on this conversation.
Absolutely, and I think the biggest thing is if you're somebody who's witnessing somebody, it's about being open, non-judgmental, not making statements like, oh, just get over it, buck up, right? Because these aren't things that we can just get over or that we can just buck up through. And so we have to be patient, but we also have to take care of ourselves because being there for somebody who's struggling with a mental health issue like depression can often be tiring to that individual as well. So it's about self-care and supporting each other through the process. And we're grateful to be in a situation where with you, we can tell people there are options and to not be afraid to reach out.
Yeah, I love it. Well, thank you so much, Sean.
Thank you.
And as Sean said, do not be afraid to reach out because honestly, you are not alone in this. And there are options that are available that will work for you. So the key is to have that conversation, pick up the phone and call for a consult so that you can learn more about what's best for you. And I'll see you after the break. This segment sponsored by Viking Psychiatry.